is our pelvic girdle. It's going to attach the bones of your leg to the actual skeleton. So what do we have in the pelvic girdle? You have a pair of os coxae. Os coxa singular, os coxae plural. So the os coxae articulate on either side with the sacrum. So we call this joint sacroiliac joint or iliosacral joint. Okay, you can go with what you have in your book. And then there are three bones that make the os coxa. The broad end of the bone, this is your ilium. This is your ischium. The pubis is in the front, this piece. And between the two pubic bones you have a disc. They call it pubic symphysis or interpubic disc. Let's go with pubic symphysis. Okay, let's learn the hard way, but the good way. Then the hole here, it's a big O, letter O. So O for obturator foramen, exactly. Okay, and then there's a cavity on this bone. So what are we going to call? Fossa. What bone is that? Iliac fossa. And this little raised area here, the crest, iliac crest. And you see two little spines. One spine here, one spine here, one is above, this is below. So this is the front. So what are we going to say? Anterior, superior iliac spine, anterior, inferior iliac spine. The same thing if you look from the back, it will be posterior superior and posterior inferior. Okay, and then there is a cavity here on the side where the femur will articulate. What is that large cavity? Acetabulum. Acetabulum. This one right here. Can you see that? The femur, the head of the femur will go there, like that. But of course this is the right, so can you see that? That's your acetabulum. Then on the back of the ischium you have this rough raised area, tuberosity, ischial tuberosity for gluteal muscle attachment and other muscles. Okay, now let's do the femur. Okay, that's your femur. The femur is obvious because it has a very prominent head. It projects a little bit away from the head of the, unlike the head of the humerus, this is a little more prominent. So if I have a humerus, so let's put them together in the light. Can you see the difference and see the size? This is shorter, this is longer. Most of us, our bones in the arm are shorter than the bones in the leg, unless you are different. Okay? So don't mix them up. This looks very obvious. And that's your front view, anterior view. Okay. The projections, all the projections you see obviously in the posterior view. So that's a hint, which is my front back. And also the head will articulate only one way on your pelvic girdle. Okay, so that tells you whether it's your right or left. So here we have the head of the femur. You can see the trochanterus a little bit from the anterior view, not much. There is an intertrochanteric line which is not obvious on this bone. So we will leave that alone for now. But if you see on the posterior view, you can see the trochanterus very clearly, right? What is this? Greater trochanter, Trochanter. Lesser trochanter. And connecting the two, the little raised area, intertrochanteric crest. I stress the teric because you have to write T-E-R-I-C. Most of the students write intertrochanteric crest. without the E. Okay, so it should be Trochanteric, trochanteric crest. At the bottom, the inferior end of the bone, what do we have? The two nice condyles, medial, lateral, will depending on the right or left. So if this is my right femur, that will be medial and lateral, medial, lateral. Okay. So these are the epicondyles, medial, lateral. What about the cavity between the condyles? Between means, how do we say? Inter, meaning between. Between the condyles, cavity, so intercondylar fossa. That's for the femur. Now let's look at the tibia fibula. So if you have a tibia and fibula, how can you tell the difference? Obviously one bone is thicker, the other bone is fine. Okay, so you can see that. The thicker bone is the tibia, it's always medial. So this is my left leg attached to the foot, and the fibula will be lateral. Okay, the medial bone is your tibia, that's your weight-bearing bone, and the head looks nice and big and round. If you see, it looks kind of triangular. So the top of the triangle will be facing the front. The other way you can tell the front is the tuberosity. You see right below the head, you see the tibial tuberosity. Okay. That's your head, tibial tuberosity. At the inferior end, we have what we call what? What is the name of the part? Think of your M&M. Medial malleolus, like in your M&M. Medial malleolus. The lateral malleolus is on the fibula. Okay, that's the lateral malleolus, the head of the fibula. Those are the two parts that we need to know on the fibula. And then on the tibia on the other side, you can see the condyles and the intercondylar eminence. Those are your condyles, and you can see projection on the top. That's your intercondylar eminence. That's your lateral malleolus. Then let's look at the foot. Foot is easy compared to the hand. Okay, so if you have a foot, okay, it looks like that. The big bone, the biggest or the largest is your heel bone, calcaneus. How do you spell it? C-A-L-C-A-N-E-U-S. What is this bone on top of that? Talus. Then cube-like cuboid. This one looks kind of like a ring on your foot, navicular. Three bones with the same name, cuneiform, C-U-N-E-I-F-O-R-M, based on the location, medial, lateral, or intermediate, depending on the foot. Sometimes they number them 1, 2, 3 based on the numbering system. Let's go with what you have in the book, medial, lateral, intermediate, depending on right or left foot. And these are numbered similar to your hand, but you have to remember this is your metatarsal, and those are your phalanges. The numbering starts from your big toe going down. Okay, so big toe is always number 1. Wherever the big toe is, depending on that, you have to call it medial, lateral. The big toe is the clue because that's always medial. You can move the toes inside your shoes. Okay, all that you can do in your exam. Right? You can bring yourself. If you learn from your body, you can get 100. So what will be this one? Third metatarsal. So what will be this one? third middle flanks. Okay, you got it, right?